So this OSCE station is using therapeutic taping techniques, specifically with kinesiology tape, and we'll look at two techniques. So one of these is a J-strap, and we're going to use this to support the inverters of the foot, and our other technique is a reverse J-strap, which we're going to use to support the everters of the foot, and we're going to put one of these techniques on each foot. The tape that I prefer, other tapes are available, but the tape that I prefer and that we're going to use today is called kinesiology tape. Kinesiology tape is useful because it's stretchy, basically. So you can apply different levels of stretch, and therefore we can be a little bit more targeted with the therapeutic effect that we want our taping technique to achieve. The other benefit with kinesiology tape, given its stretchy properties, is that it will stay on much more effectively and be much more tolerable for patients. So typically this will stay on for 2 to 3 days in most patients, so we can get a longer period of effect. If you use rigid zinc oxide tapes, my experience of those is that they're usually a bit less tolerable and they'll pull off or crease up. The relevance to practice for this and why we're teaching it to you is that you'll see lots of lateral ankle and lots of medial ankle pathology as a foot and ankle specialist. So being able to reactively and immediately offload those structures using taping techniques is quite advantageous. Whilst it's not going to resolve all of your patient's problems and is one small part of a treatment or management plan, it's very low risk, it's quick and easy and cheap to do, and it can be really quite effective in modulating and managing patient pain responses for a number of common lateral and medial ankle pathologies that you'll see. So your instruction sheet for your taping station OSCE will instruct you to, first of all, apply a J-strap taping to the right foot. So first step is picking the correct foot. Is this your right foot?
Yes.
Wonderful. 1 mark to me. So next step, given that we're looking at supporting the inverters of the foot, we want to broadly measure where our tape needs to go. There's a number of different ways that you can do this, but if in doubt, follow broadly the path of either tib ant or tib post, because they're the structures that you're looking to support. So if in doubt, know your anatomy. If you don't know your anatomy, then it's going to be a tough time. So we want to support the inverters of the foot. So to do this effectively, oh look, Sandrina knows because she's been through this. We're going to start from an inverted position. So when we apply our stretch to our tape, it's going to apply more resistance to eversion. So it's going to more effectively support the inverters of the foot. So typically I will anchor on the underside of the foot. Again, the anchor point doesn't matter too much, but as long as you're on the plantar aspect of the foot and you've got good adherence, so it enables you to get a good pull and a good stretch on the tape. So a little bit of friction, so rubbing the tape activates the glue, so it means it'll adhere more effectively. And then if you just invert your foot for me, you're going to pull up and round. Anchor again, and then smooth your tape in so you're avoiding all creases. For the purposes of your OSCE, you only need to pop one piece of tape on here. In real life, in practice, you would probably reinforce this with a 50-50 tape. So when you put on your subsequent pieces of tape, it will cover 50% of the previous piece of tape. But for the purposes of the OSCE, that's all you need to do. If you prefer to come posterior to medial malleolus and follow the path of tib post, that is also absolutely fine. So for part 2, relax. That feel good?
Yeah.
Correct answer. So for part 2, it will tell you to apply a reverse J-strap to the left foot. So if you found out which one the right foot is, then the left should be easy. So automatically your life's already better than it was for the first bit of taping. And this therapeutic aim is to support the everters of the foot. So given what we've just done for the inverters, it makes logical sense that we'll do the opposite for the everters. So exactly the same, we're going to tape into a passively or actively, if your patient is able to, everted position, and then to support the everters of the foot, we're broadly going to follow the anatomy of the everters. So we're going to move around where the perineals go. So then as resistors of inversion, when the foot wants to invert, the tape will apply a nice amount of resistance to give some nice afferent feedback to the brain, which Sandrina knows all about because I've taught her it in 3rd year. So just relax for me, good. So if you can hold your foot in that position, that's great. So same again, we're going to anchor this time on the other side of the foot because I think it gives me a good amount of resistance to be able to pull it into eversion. So rub the tape to get your nice anchor point and adhesion in the first place. And then with a full or 90% stretch, we're going to wrap around broadly in the anatomical area where the perineals are, and then just smooth the tape in to make sure we've not got any creases in there. Again, if you want to come posterior to lateral malleolus and follow brevis and longus, you can do. Personally, I like to sort of wrap around a little bit because I think it provides a little bit more resistance to that inversion. Feel good? Yeah. Good, and that's all you need to do. So again, not needed for your actual OSCE examination, but should you wish, you can add securing strips on the tape, and this might help with the tape staying in situ for a longer period of time. But for the purpose of the OSCE, all you need to do is apply one piece of tape in the relevant area as per the instruction sheet, but in practice I would reinforce these to enhance the effectiveness. So common mistakes with this OSCE station are people will put the wrong taping technique on the wrong foot. You won't get credit for that. So make sure you read the instruction sheet and you're applying the right taping technique to the right foot or the left foot, depending on what it says. And you've read the therapeutic aim, so it will be on the instruction sheet. So it's telling you what you need to offload, i.e. we need to offload the inverters or offload the everters. So not putting the foot in the correct passive position will reduce effectiveness of the tape, and that's another common mistake that students will make. Not putting enough stretch through the tape, so it doesn't provide enough passive resistance, or putting too much stretch through the tape that it won't adhere very well and it just pulls off the skin. Having the tape usually too long is the issue that students have, because they'll measure and then they'll cut exactly to how they've measured and forget the fact that this is quite a stretchy tape. So you'll always end up with a good few centimetres additional length. So if it's a little bit short, you'll usually get away with this, but it needs to pass the ankle and the subtalar joint to be effective. So incorrect length of tape's the other one. And then the last one that I can think of is that you won't get good adhesion or you'll leave lots of creases in the tape. And that reduces its ability to adhere well, and it can feel a bit more uncomfortable and doesn't look as nice. Rodrigo informs me that another common mistake with taping is that students manage to stick it to themselves and then stick the tape to the tape and get in a mess with it. So be normal. If you anchor this and just peel a bit of the tape off, it will help reduce this risk of you sticking it to everything and everywhere apart from where you want to stick it to. So peel a bit of the tape off that you can anchor it, and then peel the rest off, or bit by bit as you go, and incrementally smooth and adhere onto the patient.